name is John Scheel, and I'm from Vanderbilt University Medical Center. I wanted to discuss in a little bit more detail the health-related consequences that people are already facing from climate change. First, there are direct and indirect effects of climate change on human health. The direct effects are easily observable, such as increased heat waves that are causing heat-related illnesses like heat stroke. These effects will primarily be felt by vulnerable populations like the elderly and the poor, who are less likely to have air conditionings or work outdoors, particularly in the agricultural sector. There are also indirect effects that are a little bit more difficult to measure. However, we can see the effects on our health already. The increased temperature and humidity are increasing the areas, particularly in the United States, that are more favorable to mosquitoes, and this increases the distribution of vector-borne diseases like yellow fever, malaria, and Zika virus. We also know that climate change and pollution increases cardiovascular and cardiopulmonary disease, and also climate change affects mental health problems. In fact, climate change affects every organ system in the human body. As COVID demonstrated, poorer populations, racial minorities, and elderly will be more affected by climate change. These populations are less able to change their situation to adapt to the changing climate. However, eventually everybody will be affected. Extreme weather caused by climate change reduces crop yield, and this will increase food prices. This will lead to food insecurity and social unrest. And this will also lead to mass migration to cooler climates where easier access to fresh water. And so this will, as people migrate into these cooler climates, it's going to affect everybody. So it's best to address the situation now while we have a chance to actually impact the outcome. Eventually, we're not going to be able to impact the outcome. Many radiologists have suggested that working on climate change is outside our mission and outside our training. It's not our problem. Let policymakers and industry deal with it. However, nothing could be further from the truth. We are closing in on the maximum temperature change from the pre-industrial revolution that scientists predict will be the tipping point for our environment. This isn't the time to wait for someone else to solve the problem or blame other people. The WHO called the climate crisis we are facing as the greatest humanity threat has ever faced. We really need everybody's hands on deck and everybody to work together to solve this problem. Thank you.